Good morning, everyone, and welcome to this wonderful morning with Dr. Murali Bharadwaj on a cup of tea. Ramya, Swati, Rahul, Rajesh, Vivek Roy, and many more who are all online. Many people imagine preparation for NEET PG is very humongous process. It requires a lot of preparation. No, sir. You don't need a lot of preparation. Nice to see Dr. Lalit Shukla and many more. What you need to become a topper is a serene preparation, a focused approach, 50,000 high yield facts. You need to master them. And every day I give you a subject test with 100 MCQs. 100 days, 100 into 100, 10,000 questions, focused practice. Before coming to the session, take an opportunity to answer these 100 questions yourself. I will only give you the questions, not the key. Take opportunity to solve 100 questions. There's a schedule, 3 days anatomy, 3 days physiology, 3 days biochemistry, like that for 100 days covering all 19 subjects. The moment you develop that atomic habit of religiously practicing the questions and then going back to the 1200 pages notes that I will be sending you when you subscribe with us. There are also 600 hours of video content in the Score Learning app to discuss these 50,000 high yield facts. But most of the times, you yourself can master those 50,000 high yield facts quickly by going through the notes which I have given you. So if you do this diligently every day, in 100 days, automatically you will get a sort of confidence, a ring of jnana around you, and you will become the topper. So let's make the great beginning, doctor. So today's mock test day 2 in anatomy is very interesting. Can the online students can punch is the voice loud and clear for all of you without any interruption, because I'm broadcasting from home. Hope that there is no interruption. Hariharan, Ramya, Lalit Shukla, Swati, Rahul, how is the broadcast? Can you please punch? Is it clear for all of you? Please do mention whenever there is any lag over. Lag over should not be there. but still if lag over is there. Can you all punch whether the voice is loud, clear for all of you? Then we can go forward. Yes, thank you very much. So, doctor, a 50-year-old who has diabetes, having difficulty avoiding urine, there's a decreased sensation of the perineal region, which reflexes is most likely affected. So, it is the anal wink. You should know the anal wink. What is the sensory afferent fibers of the anal wink reflex? It is the S2 through S4, S2, S3, S4 is the root value for the afferent limb of the anal wink reflex is what you should remember. Umbilicus, you should know the root value, T10, innervates dermatome. Nipple, what is the dermatomal value? T4 innervates the nipple area. So all these things you need to be razor sharp and sure when you go to the entrance, because they're all the petty numericals, but you need to master. So between dura and arachnoid, you have the subdural space. Subdural hematoma is venous, epidural hematoma is arterial, as all of you know. A 2-month-old baby, congenital stenosis of aqueduct of Sylvius. So, what is the most likely finding? So, aqueduct of Sylvius, where is it present? Between third and fourth ventricle. And the third ventricle, that's the reason there is a dilatation of the lateral ventricles, and the third ventricle is typically seen with the aqueductal stenosis. So I hope all of you have received the PDF of these test questions, daily test questions of 100 MCQs. It is also hosted as an online test and also made available as a test on the Score Learning app, both iOS and Android. If you take the test before and come to this session, it will be very interesting. What are the most important muscle to allow the air movement through larynx? So larynx is a inlet. So the vocal cords need to be abducted for the air to make an entry. So indirectly examiner asking which is the abductor of the vocal cords. It is the posterior cricoarytenoids, which are the only muscles that abduct the vocal cords. That's what you need to remember. That will widen the rima glottis for breathing. A 33-year-old woman underwent partial thyroidectomy. After that, she developed hoarseness of the voice 1 month later. With a recurrent laryngeal nerve injury, which is at a great risk, recurrent laryngeal nerve injury, there is a inability to tightly adduct the two vocal cords, and that lead to hoarseness of the voice is what you need to remember. A 15-year-old eating a fish dinner inadvertently had a bone caught in the throat. Now you should know what is meant by glottis. Glottis is the place where you have the vocal cords. Above the glottis you call supraglottis, below the glottis you call subglottis. So you should know what is the nerve supply of the larynx, sensory nerve supply of the larynx. The laryngeal mucosa above the vocal cords is innervated by superior laryngeal nerve. Below the vocal cords is innervated by recurrent laryngeal nerve. Favorite MCQ in exam. So, vocal cord के नीचे recurrent laryngeal nerve. Above the vocal cord, superior laryngeal nerve. Of course, all these laryngeal nerves are ultimately the branches of the vagus nerve. But still, you need to know above the vocal cord, superior laryngeal nerve, below the vocal cords, recurrent laryngeal nerve is what you need to remember. A 25-year-old underwent surgery for thyroid nodule. Now she complains of dryness of the skin, muscle spasms. So always muscle spasms means you need to look for hypocalcemia. So whenever thyroid nodule is removed, there is a chance of affecting parathyroid glands, leading to hypoparathyroidism postoperatively, leading to hypocalcemia is what you should remember. Very good. Rahul Sai rightly said, low calcium. So keep punching your thoughts, doctor, into the chat window. It's like interactive session that we have in a live face-to-face class. If you are punching your answers into the chat window, right? Then you will also not feel sluggish and sleepy when you are attending an online class. 47-year-old man, right arm weakness, difficulty speaking, expressive aphasia. Always, whenever there is any dominant hemisphere in a right-handed person, left hemisphere is dominant. If the middle cerebral artery occlusion on the left is there, then typically that lead to development of aphasias is what you should remember. You're doing carotid endarterectomy in a 55-year-old. Whenever you approach internal carotid artery, there's a chance of severing a nerve which is embedded in the carotid sheath. So what is that nerve? Very interesting question, doctor. Ansa cervicalis, you should know, is a very important thing. So what is ansa cervicalis? We have a cervical plexus. Ansa cervicalis is a branch of cervical plexus. All your ribbon muscles of neck are there, no? Infrahyoid, below the level of the hyoid, the strap muscles, they are all innervated by the branch of the cervical plexus called ansa cervicalis. It has one superior root, inferior root. The superior root of the ansa cervicalis, which is the branch of the cervical plexus, it descends within the carotid sheath. Within the carotid sheath, superficially to the internal jugular vein. And it is at a great risk of injury whenever you are approaching the internal carotid artery. So that is the reason you need to know the superior root, inferior root of the ansa cervicalis, and what do they supply? The strap muscles, omohyoideus, thyrohyoideus, geniohyoideus, they're all supplied by ansa cervicalis. Superior root is in close relation with the carotid sheath, and that can lead to the development of the injury is what you need to remember. So you need to go back to the 1200 pages notes that I have given to you, doctor, and wherever you are falling short of the concepts, wherever you're doing wrong, today only your day is very long. So from 9 o'clock till midnight, 12 o'clock, morning 9 o'clock to midnight, 12 o'clock, I'll be running behind emergencies, patients who are on ventilators, acute clinical cases. Some patient will be calling. Suddenly there is a pulselessness in the wards. So life is very busy. It's a high traffic junction from 9 a.m. So I decided early morning 6 to 8 is the best time where you are free, I am free. We all sit and solve around 100 questions. Then across the day you sit and prepare the 50,000 high yield facts, and I can go to work. So once more, tomorrow morning we'll meet. So please do come every day. Tell all your friends, right? Now, 44-year-old man falls from a tree and develops a scalp hematoma. Superficial temporal artery continues to bleed. So which artery you need to ligate? That means superficial temporal artery is a branch of what? It is the external carotid artery. So what are all the branches of the external carotid artery? So superior thyroid artery, ascending pharyngeal artery, lingual artery, occipital artery, posterior auricular artery, superficial temporal artery, and maxillary artery. These are the branches of the external carotid, you need to be sure. Finally, external carotid divides into maxillary artery and superficial temporal artery is what you need to remember. A 2-year-old girl diagnosed with torticollis of the right sternocleidomastoid. So what will happen? So when the right sternocleidomastoid develop torticollis, the head get rotated to the left side. So when the sternocleidomastoid is shortened, it leads to head being rotated towards the contralateral side is what you need to remember. Very good to see 16 online classmates. Please inform all your friends. You can post the live broadcast link every day morning 6 to 8. Inevitably, next 100 days, I am there with you to discuss 100 questions every day as a subject test paper. And these 10,000 questions are enough, along with 50,000 high yield facts I give you in the form of 1200 pages notes for you to, if you master that, you will get the seat. Hardly you require 200 to 300 hours of preparation time. That's all. You should get into the top 1,000 ranks if you study the focused material which I give you. Now, 24-year-old football player receives a blow to the skull. There's a weakness of the left sternocleidomastoid. So what do you expect to see? So you should know sternocleidomastoid and trapezius, both of them are innervated by spinal accessory nerve. So this is at a great risk in the posterior triangle of the neck is what you should remember. When you are palpating anterior neck, you have noted a laryngeal prominence. What is that? Adam's apple. Adam's apple is also called thyroid cartilage. 57-year-old with colon carcinoma. So you know very well that the visceral malignancies metastasize to left supraclavicular region, which is called the Virchow's nodes, is what you should remember. Typically, there is a cancer of vulva. So you should know what are the structures in the groin, what is their relationship. So nerve, artery, vein, empty space and lymph node. This is how the structures are organized in the inguinal area, in the femoral triangle. That is how they are being spread. So lymph nodes are medial to femoral vein. Lymph nodes are medial. Most lateral is nerve, then artery, then vein, empty space and lymph nodes, which is most medial. Nerve is most lateral. This is what you need to understand. Now, doctor, what makes lymph pass through the lymphatic vessels? It is the compression, which is the propulsive force that moves the lymph. That's the reason lymphedema occurs whenever the compressive forces are affected by various pathologies. Now, 44-year-old has a difficulty hearing from the right ear. He is having headache, weakness of the facial muscles. So what is the most likely possibility? Whenever multiple cranial nerve palsies are there, it is unlikely to be explained by a simple peripheral neuropathy. So if you look at cranial nerve 7, cranial nerve 8, all of them exit along the cerebellopontine angle. That's the reason any schwannoma involving the cerebellopontine angle can cause both 7th and 8th to get affected. Any injury to the facial nerve 7, as it leaves the stylomastoid foramen, what will it disrupt, doctor? It will disrupt the wrinkling of the forehead. So you know, Pesancerinus, the facial nerve, after it exits the stylomastoid foramen, it gives rise to 5 branches: temporal, mandibular, buccal, zygomatic and cervical. Temporal, mandibular, buccal, zygomatic, and cervical branches. So you should know in which location of facial nerve injury lead to what important symptoms. So the wrinkling of the forehead is produced by frontalis, which is innervated by the facial nerve. Facial nerve also is responsible for the taste in the anterior two-thirds of the tongue. But the chorda tympani emerges before the trunk exits through the stylomastoid foramen. So that is the reason any injury after it exits the stylomastoid foramen will not involve chorda tympani. That's what you need to remember. Then other options given were sensation of the cheek and cornea. Facial nerve is motor, not sensory. So that's the reason corneal sensation, cheek sensation are all through the trigeminal nerve, not through the facial nerve. That's how you eliminate the choices is what you should remember. A 33-year-old woman suffered a skull fracture, unilateral facial nerve palsy. So whenever any basilar fracture involving the mastoid area, then it affects the stylomastoid foramen. A 56-year-old is having stroke. There is a marked deficit in the bite strength on the affected side. There is a weakness of the muscles of mastication. So the muscles of the mastication are innervated by the mandibular division of the fifth cranial nerve, trigeminal. The same thing which also innervates the anterior belly of the digastric. So you should know the anterior belly of the digastric nerve supply comes from the mylohyoid nerve. Mylohyoid nerve, which is the branch of the mandibular nerve, which innervates the anterior belly of the digastric. Whereas the posterior belly of the digastric is innervated by the facial nerve, is what we need to remember. Now, doctor, a 45-year-old woman who has diabetes developed shingles in the right cornea. So, which nerve varicella virus will travel to reach cornea? You should know corneal sensory supply comes from the fifth cranial nerve. Corneal reflex may there is one afferent and one efferent. We close the eyelid. Closure of the eyelid is due to facial nerve, efferent limb of the corneal reflex. Whereas sensory supply of the cornea is with the fifth cranial nerve. So you should be very clear on this point. Corneal reflex made two components. Whenever you touch with a cotton swab of the cornea, immediately there is a blinking of eye, right? So blinking is efferent. Sensation of the cornea is afferent. Afferent is by the fifth cranial nerve. Blinking of the eye is because the seventh cranial nerve is what you need to remember. Efferent is seventh. You are doing physical examination. Hariharan says, hi sir, how to get PDF? Please WhatsApp or call 9000 868 356 Hariharan. And this is our helpline number. They help you to subscribe and enroll to the 100 days daily mock test and discussion crash course program. Now, during a physical examination of the patient, you notice ptosis in the left eye. This indicates paralysis of which muscle? So ptosis is due to the levator palpebrae superioris. All the muscles in the face, motor supply is facial nerve. The only exception is levator palpebrae superioris, which is innervated by the oculomotor nerve, is what you need to remember. Now, you are doing testing of superior oblique muscle. To test the superior oblique muscle, what will you ask the patient? You ask the patient to look towards the nose and then down. Look towards the nose means adduction, and then look down means depression, which is the function of superior oblique muscle. So, what are the actions of superior oblique muscle, doctor? You need to be very sure. Remember, solid is the mnemonic. Lateral rotation, intorsion, depression. Lateral rotation, intorsion, depression. So this is superior oblique, the actions of the superior oblique muscle. So whenever you turn the eyeball inwards, that places the portion of the superior oblique between the trochlea and its insertion places the axis of the muscle in line with its action. So that is the reason you should know different positions, how to test various muscles. Now, once more, how do you test superior rectus? You ask the patient to look laterally with her right eye and then upward. That's how superior rectus is tested. So, please don't forget this very important uh, picture, doctor. One of the favorite area of the examiner. Superior rectus. How will you ask? What will you ask the patient? Look laterally upwards. Look laterally upwards. Inferior rectus. Look laterally downwards. Lateral rectus. Look laterally. Medial rectus. Look medially. Inferior oblique. Look medially upwards. Superior oblique. Look medially downwards. This is how you test the various extraocular muscles. One of the favorite question of the examiner, doctor. Bhulna nahi. What is the primary action, secondary action of each of these extraocular muscles, and which direction you ask the patient to look in order to test the various extraocular muscles you need to be very, very sure about. So what are the various layers that describe the scalp? Scalp is skin, connective tissue, aponeurosis, loose connective tissue, and periosteum. Skin, epicranial aponeurosis, loose areolar tissue, periosteum. 65-year-old, severe pain on the right side of the head. Temporal arteritis. It is the deep temporal artery which is involved in temporal arteritis. So you should remember, temporal arteritis is a spectrum disorder. One end of the spectrum is temporal arteritis, other is called polymyalgia rheumatica. So in both of them, there is an increased ESR, jaw claudication, etc., etc. In general medicine, we discuss this very detailed way. So don't miss this. Now, doctor, a neurologist uses a pin to test the sensation of the scalp near the hairline anteriorly. So you should remember, in the scalp, anterior scalp is supplied by fifth cranial nerve. Posterior scalp is supplied by the spinal nerve C2. Please don't forget, posterior scalp is by the spinal nerve C2, anterior by trigeminal nerve. Now, any arterial bleed of the meningeal arteries lead to epidural hematoma. What is the cause of subdural hematoma? Whenever you shake a baby, subdural hematoma is all venous bleeding coming from the emissary veins. 21-year-old comes to the emergency. Where is pterion? Pterion is the point of confluence between temporal, parietal, frontal. All the three bones is what you should remember. I'll try to run very fast. Just bear with me. Whenever there is any laceration involving the right cheek, what is the typically from the right ear, tragus, to the corner of the mouth, if you draw a line, that is the line where the parotid duct will be passing. So the buccal branch of facial nerve and parotid duct, what is the surface marking between the external auditory meatus and the Angle of the mouth, if you draw a line, that is the point through which the parotid duct will be traveling. 45-year-old is undergoing resection of the salivary gland. She cannot move her tongue very well. So now a very important question comes. Hypoglossal nerve is the one which innervates the tongue. Hypoglossal nerve is in a very close anatomical relationship with the deep lobe of submandibular gland. Hypoglossal runs deep to the submandibular gland. Any injury to this nerve weakens and paralyzes the muscles of the tongue is what you need to remember. 16-year-old girl, bilateral swelling of the cheeks. They are non-tender, multiple dental caries. What is the likely diagnosis, doctor? Bulimia. So any parotid gland enlargement, multiple dental caries means it's a spot diagnosis. Bulimia nervosa. 53-year-old. What level carotid artery bifurcates? So you should know all these anatomical levels. At the level of the thyroid cartilage, the carotid bifurcates into external and internal carotid is what you need to remember. A 64-year-old man is being diagnosed. Very nice to know Dr. Chenna Keshav just now WhatsApped saying that, sir, I am following you since 3 years. This year I got MS general surgery at KIMS Amalapuram. Very rarely I interacted in group discussion, but whatever I got time, I used to listen. Thank you so much. I am happily bowing to your dedication and love towards PG fighters. You made my day, Dr. Keshav, by saying that. And in fact, it is the students who are the inspiration for a teacher every day to prepare myself, come back, study along with you. So thanks to be my companions and keeping me. Now I have hit 50. I started teaching when I was 24-year-old, when I myself became a topper in PG entrance. In the past quarter century, 2 lakh medical students, I got opportunity to touch their lives. And many of them, thousands of them with their sheer hard work have become toppers. The same questions we had been discussing past quarter century. So what is needed to become a topper is sheer perseverance, doctor. Perseverance is everything, right? So we need to believe in ourselves that we are born to become great. That is the only way that we become a hero in our own lives. So 64-year-old man diagnosed with acute stroke. His main deficit is partial loss of his visual field. So once more, thank you, Dr. Keshav. I'm truly humbled. Now, doctor, there is a deficit in visual field. There's a lesion in the occipital lobe. What is the blood supply of occipital lobe, doctor? Posterior cerebral arteries, which are the terminal branches of the basilar artery. All of you know, vertebral artery binds with another vertebral artery to form basilar artery, and that divides into posterior cerebral artery. So this is the basilar artery. So from here comes pica, posterior inferior cerebral artery, anterocerebellar artery, and all the vessels that supply the cerebellum arise from the basilar artery and vertebral artery. So medial medullary syndrome, lateral medullary syndrome of Willenberg, all these things in the brainstem stroke, you need to be 100% sure, doctor, when you go for the tomorrow's exam. A 35-year-old man complains of the worst headache of his life. Subarachnoid hemorrhage is due to the rupture of the berry aneurysm. Now, there is a placement of tube into the tympanic membrane. What is the structure that get affected by that? It is the disruption of the chorda tympani, which is at great risk. Chorda tympani is a branch of the cranial nerve 7. It courses behind the tympanic membrane. Any surgery on the ear tube lead to the development of the cranial nerve 7 branch, chorda tympani, to get affected. Chorda tympani carries the anterior 2/3 of the tongue taste sensation. Now, what carries the sensation of the pain from the tympanic membrane? Whenever we get otitis media, it is a nagging pain we have. So, a 5-year-old girl who has got this pain, tympanic membrane is cranial nerve 9. Cranial nerve 9. So the glossopharyngeal nerve is the afferent nerve for the sensory input from the internal surface of the tympanic membrane, is what you need to remember. A 3-year-old boy has 3 episodes of otitis media. Why children develop otitis media more than the adults? What is the anatomical reason? If you look at the eustachian tube, it is shorter, more horizontal in a child than in the adult. That makes pediatric age group to get the otitis media more than the adults, is what you need to remember. A 24-year-old, there is a nasal discharge during the night but not during the day. How do you explain? So typically, maxillary sinus is most commonly affected sinus. And if you look at the ostia within the sinus, they are located superiorly in a location which is inefficient for the gravity drainage. So that is the reason during the sleep at night, the mucus flows out through the ostia. So that explains the diurnal variation of the pain in maxillary sinusitis. Superior nasal meatus. So you should know each of the meatuses, what drains into what, the various sinuses. Posterior ethmoidal sinus drains into the superior nasal meatus. 28-year-old, afferent nerve supply from the sinuses. The paranasal sinuses are all innervated by the branches of the 5th cranial nerve. Trigeminal nerve is what you should remember. Now, palatine tonsil. Along the tonsillar bed, what is the main artery? It is the tonsillar branch of the facial nerve, which lies in the bed of the palatine tonsil, is what you need to remember. So even ascending palatine artery also supplies the tonsillar bed. But generally, ascending palatine artery is not affected by the tonsillectomy, but the tonsillar branch of the facial artery is commonly the source of the bleeding, and it is the one which get affected, is what you need to remember. A patient has mild chronic cough. So how is the cough reflex? Afferent of the cough reflex is through the 9th cranial nerve. So the trigeminal nerve innervates the oral and nasal cavities. The cough reflex is stimulated by the laryngopharynx, which is innervated by the glossopharyngeal nerve. You need to be very careful and clear. These are all the simple questions, but they will create a huge difference when you go for the entrance exam. Now, which structure passes through the gap between superior and middle constrictor muscles? It is the glossopharyngeal nerve. So the glossopharyngeal nerve passes between the gap between the superior and middle constrictors along with the stylopharyngeus and stylohyoid ligament is what you need to remember. A 24-year-old man evaluated for the airway abnormalities. Where is the cricoid cartilage located? So all these anatomical levels you need to be sure, doctor. Cricoid cartilage is at the C6 vertebral level. Hyoid bone is at the level of the C3 vertebral level. Thyrohyoid membrane C4. Thyroid cartilage at C5. Cricoid cartilage is at C6. The cricoid cartilage. You can see the cricoid cartilage here. So these are the various anatomical levels. Examiner shrewdly expects you to remember. There is no other option. All these things I have given in a 1200 pages notes, doctor, for you to do the revision. Now, so can the online students can punch? Is the voice loud and clear for all of you? Kindly punch so that I'm very sure internet broadcast is okay. 45-year-old undergoing thyroid surgery. There's a bleeding from the isthmus of the thyroid gland. What is the source of bleeding? It is the thyroidea ima artery. It arises from the aortic arch or the brachiocephalic trunk, and it reaches the thyroid isthmus inferiorly. It is one of the common sources of bleeding, is what you should remember. Thank you, Shivakumar, and many more, that the broadcast is loud and clear for all of you. Yeah. So now, there is a thyroid dissection, twitching of the arm and spasm. So it is the parathyroid glands which are removed and hypoparathyroidism is responsible. Cricothyroidotomy is being done. Where is the location of the cricothyroid membrane? Cricothyroid membrane. So you need to remember, immediately inferior to the thyroid cartilage, above the cricothyroid muscles, you have the cricothyroid membrane, is what you need to remember. Some of you are going to become intensivists. You are going to create the airway for a asphyxiated patient. So you need to be doubly sure about, doctor. 55-year-old man is anemic, hypotensive due to severe epistaxis. So which artery is responsible? It is the sphenopalatine artery, the major supply to the anterior septum is the sphenopalatine artery, which is a branch that supplies the nasal septum. The sphenopalatine arises from the maxillary artery, which is the terminal branch of the external carotid artery, is what you should remember. 18-year-old woman arrives. There's a bleeding from the right nostril. What is the most likely location for epistaxis? It is the anterior nasal septum. You have the Kisselbach's plexus, which is the rich anastomosis. So there is a nasal leakage from the nostril after a road traffic accident. Typically, any damage to cribriform plate lead to development of rhinorrhea, where the CSF flows out. 67-year-old comes with dental abscess. So whenever dental abscess is there, after that he has a chest pain, mediastinitis. How does it spread? It is to the retropharyngeal space. Where is retropharyngeal space, doctor? It is between prevertebral layer of the fascia and the buccopharyngeal fascia. So there is one prevertebral layer. So remember, there's a prevertebral fascia before vertebra. There's a buccopharyngeal fascia. Between the two, you have the retropharyngeal layer, which is the common way by which a dental abscess becomes spread into the mediastinum, is what you should remember. So which is called the dentist nerve. So it is the trigeminal nerve, most important for the dentist. So inferior alveolar nerve, which is the branch of the mandibular division of the fifth cranial nerve, is the one which is often captured during the dental anesthesia. So Navina is saying, thank you Aishwarya for joining the session. Aishwarya is our resident. So the lips that pray and the hands that deliver, if you compare the two, the lips, the hands that deliver are holier than the lips that pray, said Mother Teresa. So 2 to 3 hours preparation is more than enough. You can still work 5 to 6 hours. I really appreciate those who prepare for the PG medical entrance while they are still doing the clinical work. That's a great combination. Actually, that prevents any boredom. So on one side, you are doing the workup of the patients. You are very busy in the clinical rounds, wards, discharging, counseling the patients. And at the same time, you are coming back, finishing the high yield facts quickly, and then solving around 100 questions with me every day morning, 6 to 8. Surely that is how you will get the top rank doctor. Let me tell you. But still, our time is short. Another 100 days is there. So there's a reason. Fill the gaps, doctor. Those things which you are afraid to revise, those things which you never studied in MBBS, still you need to study, you need to master, you need to get ready to drill through the competition. There are about 240,000 people are competing for hardly the top 5,000 ranks. If you want to get into a government college, that means competition is more than a dog fight in the street. So we have to fight it. For that, do we need to melt ourselves? Not required. There is 1200 pages notes. I will courier you. And every day, 100 questions I discuss. This 1200 pages notes has 50,000 high yield facts. Just master them, more than enough. 100% strike rate in the tomorrow's NEET PG from the 100 daily test papers that I am going to discuss in the next 100 days in this crash course. I can assure you, past 25 years, 2 lakh doctors I had a privilege and opportunity to give coaching. Every year on year, we have a glimpse of smile when we see the question paper. Hey, we discussed this, we discussed this. All 200 questions we discussed in our test series. So that's the reason. Just stick to the plan. At least 4 or 5 hours, spend your time. Make your own set of things that you want to regularly revise and master. Automatically, you will get seat. You don't need more than 200-300 hours of preparation. 24-year-old comes to emergency, 2 centimeter laceration in anterolateral neck. The wound is superficial. So what is that important contributor for the superficial fascia, doctor? Just deep to that, what do you have? Platysma. The muscle is the flat muscle that is in the anterolateral area of the neck. 30-year-old woman underwent blunt trauma to the left eye, unable to secrete tears from that eye. What is the most likely location where your lacrimal gland is located? It is the superior and lateral aspects of the orbit where the lacrimal gland is located. A clinician places dye into the right eye to know the patency of the tear duct system. So where does the lacrimal duct system drain into? Inferior nasal meatus. Now, a 5-year-old boy, severe pain, swelling, redness around his right eye. So how does periorbital cellulitis spread to the cavernous sinus, doctor? Everything, anything about what are the various things draining into the cavernous sinus, you need to be very sure. What is located, which cranial nerve is located within the cavernous sinus, everything you should master. The facial vein to ophthalmic vein to cavernous sinus into the dural space. That is the root of spread of infection. So periorbital space through ophthalmic vein into cavernous sinus into the dural space, leading to the development of the meningitis is what you need to remember. So now, doctor, blood supply of the bulb of penis, all the remaining questions are very single liners. So if you look at the question paper of the NEET PG, 80% question paper is clinical based questions. Clinical based questions are very easy to crack. 20% questions are single liners. Single liners is like you proposing a girl. I love you. Do you want to get on my bike? So that kind of questions. Only yes or no kind of answers. You know it, you have it. If you say yes, you have it. You have no, you don't have it. Simple. So whereas case-based questions are, you can logically think and answer. Here, there is no logic. You know it, you don't know it. That's all. Game is over. So what is the blood supply of the bulb of penis, doctor? Bulbourethral artery. Cremastic nerve muscle is supplied by genital branch of genitofemoral nerve. Endometrial blood supply is by the spiral arteries. Alcock's canal transmits pudendal nerve. Posterior superior iliac spine. It is the S2. It is at the level of the S2. Coccyx is having 4 vertebrae. Perineal body. Perineal body. What are the various muscles that constitute? External sphincter, iliococcygeus, superficial transverse perineae. Then it is the bulbospongiosis, not bulbocavernosus, which is the part of perineal body. So perineal body has levator rani, bulbospongiosis, deep transverse perineal muscles. So please don't forget, doctor, this is one of the favorite batti marne wala item hai. Perineal body, what are the components? You need to be 100% sure. Bulbospongiosis, superficial transverse perineae, superficial part of external anal sphincter, sphincter urethrae, deep transverse perineae, deep part of the external anal sphincter and levator rani. Without hiccups, you need to tell all these 7 components of perineal body. Similarly, superficial perineal pouch, what are the boundaries? Right? Deep perineal pouch, what are the boundaries? All this you need to be sure. So what is levator rani made up of? So you should know pelvic floor is formed by pelvic diaphragm. Pelvic diaphragm has levator rani and coccygeus. Levator rani has puborectalis, pubococcygeus, iliococcygeus. And coccygeus is having ischiococcygeus. Together levator rani and the coccygeus constitute the pelvic floor is what you need to remember. Prostate gland, the glandular tissue and fibromuscular stroma. Cavernous sinus, it is the abducens which passes. Abdominal part of the esophagus is the left gastric artery and the inferior phrenic nerve. They are the ones which supply. Skin over the parotid is supplied by the whole face sensory supply trigeminal. Only exception, the skin overlying the parotid gland is not supplied by trigeminal, but it is supplied by the greater auricular nerve, is what you need to remember. Of all the cerebellar nuclei, it is the fastigial deepest. Lateral rectus is supplied by abducens. Spinal cord is having 1 anterior and 2 posterior arteries. Anterior 2/3 of the spinal cord is supplied by the anterospinal artery. Temporal bone, It is the post-auricular muscle which is attached to the temporal bone. So if you look at the genioglossus, the purpose of the genioglossus, for example, my right genioglossus pushes my tongue to the left side. So if there is any paralysis of my right genioglossus, what will happen? My left genioglossus is unopposed. So that will cause my tongue to be deviated to the right side. Once more, my right genioglossus pushes to left. If it is not working, my left one will push the tongue towards my right side. So right genioglossus cause the tongue to deviate to right side, ipsilateral side. Left genioglossus will cause the tongue to get deviated to left side. So it is the ipsilateral deviation, because the purpose of genioglossus is to push, not pull. Push. So because it normally pushes to left side, for example, right genioglossus pushes to left side. If it is paralyzed, the left genioglossus unopposed will push it to, deviates the tongue to right side. So right genioglossus paralysis lead the tongue to go to the right side ipsilaterally is what you need to remember. So all these deviations you need to be very sure. Tongue deviations. Arteria thyroidea ima comes from arch of aorta. Superior vena cava has no valves. Inferior vena cava also don't have valves, but only one valve. Where inferior vena cava meets the right atrium, that is the place where you have a valve. So, splenic artery, popliteal artery, femoral artery, they're all muscular arteries. Aorta is an example of elastic artery. Where is IVC formed, doctor? It is formed at the level of the L5. L5, this is a favorite question. So the common iliac veins, they combine to form the IVC at the level of the L5. So from that comes into that the renal vein, suprarenal vein, hepatic vein, everything, and it enters the diaphragm at the level of the T8 is a vena caval opening is what you need to remember. Brunner's glands, characteristic of duodenum. Tomorrow's NEETPG examiner is going to give you the histology of the Brunner gland. You need to be able to identify. Brunner's gland secrete alkaline mucus. Now, what is the visceral relation of the spleen? So this is very important. Fundus of the stomach, left kidney, splenic flexure of the colon. So these are all so here you have the splenorenal ligament, splenic artery in the hilum, gastroepiploic vessels. There is a colonic surface, and there is a gastric surface. There is an area where gastrosplenic ligament attaches. So the diaphragmatic surface and visceral surface of the spleen you need to be very, very sure about. Similarly, relationships of the kidney is one of the favorite area of the examiner, doctor. So what forms the posterior wall of the kidney? So you should remember, it is a quadratus lumborum which forms the posterior wall. What is the anterior relationship of the left kidney? Jejunal flexure, splenic flexure, left suprarenal, they are all the anterior relationship of the kidney. So you should know both the kidneys. Right kidney has a suprarenal area. This is the area where the liver is there. This is the area where duodenum is there. Colon is there. Here is the area for jejunum. Left kidney, jejunal area is little bigger. The colonic area is smaller. There is a pancreatic tail, which is very close, pancreatic area. This is the splenic area, this is the gastric area, this is the suprarenal area. So the relationships of the kidney, doctor, close the eyes and assimilate into yourself. That's the only way you can remember it. Now, what is present anterior to the right kidney? It is the intestinal loops which are anterior. Ascent of the kidney is prevented by the inferior mesenteric artery. Not superior, doctor, inferior mesenteric artery. Glomerulus is derived from metanephros. Prostate gland comes from urogenital sinus. So urogenital sinus, if you take, doctor, upper largest part gives the urinary bladder. Pelvic part gives rise to prostatic and membranous part of urethra. Phallic part differs between male and female. Now the collecting duct. Collecting duct is derived from ureteric bud. Don't forget genitourinary system, embryology. Every NEETPG you go, one question comes. Today only write it in your high-yield topic list to remember, revise, doctor. I gave it all in the 1200 pages notes to you. Collecting duct is derived from ureteric bud is what you need to remember. Synovial fluid is produced by the type B synoviocytes. Hyaline is the blue-colored cartilage. Tyson's glands are present at the glands. They are the sebaceous holocrine glands. So, persistent vital low intestinal duct lead to fecal fistula at the umbilicus. When the maxillary and the medial nasal process fail to fuse, that lead to cleft lip, as all of you know. Ribs develop from paraxial mesenchyme. So fundamentally, paraxial mesoderm gives rise to somites. They have a sclerotome, base of the skull, vertebrae, ribs arise from that. From the lateral plate mesoderm, there is a somatic mesoderm from which arise the shoulder girdle, pelvic girdle, limb bones. They all arise from the somatic mesoderm, which arise from the lateral plate mesoderm. So that is the reason you need to remember the intra-embryonic mesoderm divides into paraxial and lateral plate. Paraxial से निकलता है base of skull and vertebrae and ribs. Lateral plate is mesoderm से निकलता है shoulder girdle, pelvic girdle and the limb bones is what you need to remember. Pituitary develops from rat case pouch. So doctor, that brings us to the end of the today's journey. And रोज मिलेंगे रोज पढ़ेंगे एक दिन कामयाब होके दुनिया को बताएंगे मेरा नंबर आ गया. So getting in PG entrance कुछ भी टेंशन नहीं है. Only thing is every day you need to study, doctor. That is important. Every day you need to study. If you do that, you become a winner. Don't forget, Dr. Murli Bharadwaj is there to hold your hand. Morning 6 to 8. Don't miss it. 100 questions. Take the online test. Subscribe today only. I send you the 1200 pages notes. Give you activation, the app for the video library. Video library is not a big deal. Today, so many video libraries are there. But what is important is every day you need a classmate with whom you can sit together. You prepare 100 questions. Practice that for 100 days. Seat nahi mile to मेरा नाम मुरली भारद्वाज नहीं है, नाम तो सुना होगा. Good luck, and tomorrow we will all meet up.